So my name's Katie Coblentz, and I'm what's known as a detransitioner. And it's a big term, but you might be familiar with it. It's just somebody who transitions from one gender to another. So for me, I was born female, and through I took testosterone and I had surgeries and I transitioned. I don't love the word because there's no transition, but I tried to turn myself into a male. And after that, I ended up regretting it at one point, turning back and living my life as a female, which is the way it was intended to be from the start. So that's what a detransitioner is. I'm going to tell you basically my entire story from start to finish, and then I'm going to open it up for questions. I've been speaking for quite a while, a few years on the issue since I started detransitioning and I went back to church and everything. But since I started talking, my some people call it a ministry, has pivoted from just me standing up here and telling my story and just shining light on the issue to helping families who actually have loved ones going through the same thing. Parents will come up to me a lot, aunts or aunts and uncles, depending on where you're from in the country. It's aunts or aunts. But people will come up to me, grandparents a lot of times, tell me, my niece, my nephew, my child, my grandchild is going through this. What am I supposed to do? So I'd like the Q&A. I'll do it at the end. Any questions that you guys have, it might steer us in a certain direction. But for now, I'm just going to tell you everything I can remember about myself. So I grew up in Massachusetts, and growing up, I was a tomboy. So when I told everybody, hey, I'm actually going to be a man now, no one was really surprised. They're like, well, you played with boy boys' toys. You always wore boys' clothing. I was raised Catholic, so when it came time for my first communion, I was 7 years old. I put up a huge fight over wearing the dress. I told my mom, there's no way I'm wearing a dress. And she said, well, you have to wear a dress for your first communion. You don't have a choice on that. So we went dress shopping. I don't remember how many times we went dress shopping or how long it took us, but every single dress, I said, nope, not wearing that. All the first communion dresses, I decided I'm not wearing them. Finally, my mom said, let's just choose a very simple dress. It won't even feel like you're wearing anything uncomfortable. It won't be itchy, anything like that. So finally, we settled on something. My mom won the fight, and I had to wear a dress for my first communion. But it was extremely difficult for me, even as a small child. I just hated anything that was feminine, anything that was girly. As I started to get older, I'm in middle school now, and I'm starting to go through puberty. And all of a sudden, as probably everybody here can relate, the discomfort in my body, the confusion about who I am and who I'm supposed to be, that set in, and that set in hard. So eh, how old are you when you start puberty? 10, 11, 12, 13 years old. All those years, I hated every second of it. My breasts started to grow. I thought, well, if I get breast cancer, I won't have to have that anymore. So hopefully I'll get cancer. And that's the same way I felt about everything. I was thinking maybe I'll get uh, ovarian cancer. And I was just wanting these things. But again, 11, 12 years old, I didn't understand what it meant to actually have cancer. I just thought they'll take these organs away from me if I were to have these things. And so I wanted to have them. Never got cancer, thankfully. And when I entered high school, that's when things started to change a little bit. Now, the high school I went to a public high school over in Massachusetts, and I graduated in 2014. So I started 2010, I started high school. And back then, there wasn't the push for transgenderism. You didn't have the pride flags in the classroom or anything like that. But what we did have was the blue and yellow equal rights stickers. I think it's put out by the Human Rights Campaign, and you guys have almost definitely seen them. I think it's a blue square with the yellow rectangles. It's just an equal sign. People put it on their bumpers of their cars. And we had that, and if you saw that sign outside of the classroom, it was a safe place to talk to the teacher or anybody about how you're feeling and how you're identifying. You're like, all right, if you're bisexual, if you're lesbian, if you're gay, if you're whatever. And that's kind of the culture that I was raised in. And then another thing that was happening when I was in high school, already confused, already thinking, okay, I guess that type of lifestyle is normal. Birth control started to be pushed on me by a lot of well-meaning adults in my life. even people really close to me, teachers, health classes. It was just when you start high school or when you get your first boyfriend, you're expected that that's when you're going to become sexually active. And they just say, well, the safest thing to do is for all the girls to just be on birth control because they're going to do it. So let's do it safely and then we won't have any teen pregnancies, I guess was the idea. Well, that made me so uncomfortable. And by this point, maybe I'm 14, 15 years old. My family's not really going to church anymore. We're not really a Catholic family at this point. And I'm just extremely uncomfortable, but I don't know why I'm uncomfortable. Because I'm not taught, well, it's normal to not want to have sex with people at 14 years old or 15 years old and to just kind of want to grow up. But the culture that I'm in at the public school, and even at home, honestly, is such that no, what's normal is you start taking birth control because you're pretty close to having sex if you're 14, 15, starting high school, maybe have your first boyfriend. But I pushed back against that and I kind of overcorrected. So some of the girls in my class, they were wondering why I'm not interested in that kind of stuff. And they did a test. It was just the upperclassmen. It was not the teachers. But they had a test to determine if you're gay or straight or bisexual or anything like that. And the test was, they would just ask you a few questions. They would start with, look around the classroom. I was a girl, so they said, look around at all the boys in your class. And looking around the room, there's probably about 10, 15 boys in the class. They're, all right, are you interested in having sex with any of them? I look around again. No, not really. No offense to the boys in my class, but again, we're all just young and awkward. No, I'm not interested in that. My friend then told me, well, easy answer, it means you're a lesbian. And that was almost like a eureka moment for me. I'm like, wait a minute, I'm a lesbian. That's why I don't want to do this kind of stuff. And lesbians don't have to take birth control. So I was like, this is perfect. Now I'll never have to take that stuff. And I won't have to worry about having sex because it doesn't have to be on my radar if I'm identifying as a lesbian. And that's what I went with through the rest of high school. So that test probably happened my sophomore year, either end of freshman or early sophomore year. And through the rest of high school, I just said, nope, I'm a lesbian. Don't have to be interested in any of this stuff. And it was probably the easiest time ever. But as I'm identifying as a lesbian, I wasn't just doing it to hide from birth control. I was actually trying to figure out who I am. You're 15, 16, 17, 18 years old. You're figuring out who am I going to be? What's my adulthood going to look like? What am I going to do after high school? So I put on this identity and now I'm living in it. So now when I picture myself in the future, I was thinking, well, I'm going to marry a woman. And that was all fine. And I'm just thinking about it. But at one point, I got so uncomfortable. I was about 18 or 19 years old, right around there. It was the summer before I started college. And I'm just thinking this lesbian identity, it doesn't fit. And I tried, maybe I'm asexual because I'm not really attracted to women. But also, my friends told me I'm not attracted to men because I don't have any interest in having sex with any of them. So maybe I'm just asexual, which means you're just attracted to nobody and you just don't care about sex at all. And I was like, all right, works for me. Maybe I'll try that. It didn't really work. I said, no, that's kind of weird. I want to feel a little more normal than that. And I did try dating girls, but none of them were ever happy with me because they'd want to hold my hand or kiss me, sometimes hold my hand in public. And I thought, I don't want to look gay, right? I don't want a girl holding my hand. This is a little weird. So I had the right ideas about things. I don't want to look gay. I don't want to be gay. I don't want to take the birth control. I don't want to do this kind of stuff. But there was just a culture around me that was pushing it so hard that whenever I wanted to explore who am I, it was, well, look back to that LGBT acronym and figure out who you are on there. Explore that. Try the L and the B and all these different things. And I thought, all right, I mean, that makes sense, right? Wouldn't it make sense if that's what you're told day in and day out? Explore your identity in that. But I did it and it just didn't work until I tried out the T, the transgender. I was on YouTube, scrolling YouTube, which I did all the time, every day, all day, whenever I wasn't in class. I just wanted to be on YouTube. And I came across teenage girls about my age, maybe 17, 18, 19, give or take a few years, I don't know. And they were all transitioning to male. They would take the testosterone and they would do a video blog and they would say, this is my voice 1 week on T. T is testosterone. This is my voice 3 weeks on T. This is my voice 1 month on T, 2 months on T, 6 months on T, a year on T. And you could hear their voice from the testosterone getting deeper and deeper and deeper. And you could see their face changing a little bit. And sometimes in the videos, they'd comment on the other changes. They say, I have more muscle, I have more energy, I feel better, I'm not so quick to get sad, maybe I'm quicker to get angry, but I just have more energy, my depression's gone. And I thought, well, I have depression, and I'm uncomfortable with who I am and what my body looks like. And I was also a tomboy and then a lesbian, like a lot of these girls. So I thought, I'm going to try on that transgender identity. And I did. And I came up with a new name for myself. Well, I came up with a new name for myself. And then my parents, who also didn't have that solid Christian framework, I thought my name should be Zachary. That's a really cool name. I want the Z. My last name used to be Anderson. I always had the A. Now I wanted the Z. And my parents said, we can't do that because every time we call for you and we say, Katie, Katie, you don't hear us. You don't listen for your own name. So it needs to be similar enough to the name that we've been training you in for 18 years. So with my parents' help, we landed on Caden. And that was an easy enough transition for everybody because people would call me Kate and I just changed to Caden. It's like, all right, everybody's kind of got this down pretty quickly. And at first, because I was putting on this new identity and I was kind of getting rid of my old identity with the depression and all that stuff, even before testosterone, I was just identifying myself as a male and I had the new name and the new identity to go with it. I felt a million times better. It was like, this is what I've been looking for this whole time. Finally, I've landed on an identity. My depression's not so bad. I'm not so anxious, but problems kept creeping up. So I would be going about my daily life and, maybe I would wear one of the compression tank tops. People call them a binder to bind your chest just to make yourself look more flat chested if you're a woman. And I would wear that and I would look almost completely flat chested. But then I would talk and my voice just sounded so feminine that everybody saw through it. So then I thought, all right, my voice is a problem. I can't be who I'm supposed to be if my voice sounds like this. And on top of that, my depression's kind of coming back. I'm not quite as happy or quite as euphoric as I was when I first started this process of just trying on a new name and using new pronouns and that sort of thing. So I went to my parents and I said, I'm going to go to the doctor. I was either 18 or it may have been my last appointment with our pediatrician before I moved on to a real grown-up doctor. And my last appointment, I went and I said, I'm transgender and I'd like to be referred to a gender clinic. And there was one right down in Boston. This was 2014, 2015. We were nearing the end of the year because my birthday is in September. So my physical was right around my birthday. So we're nearing the end of the year. So come 2015 is when I was actually able to go to the gender clinic. My pediatrician didn't ask me, do you have a therapist? This is something that's required. Nothing like that. Wrote the referral, sent me to the gender clinic. Gender clinic didn't ask me if I have a therapist. They said, well, if you don't, we'll just do an in-office appointment. That'll be good enough. We just need to check some boxes, essentially, which is what we did. I went to the gender clinic, told them how I've been feeling. And they said, since you don't have a therapist, we'll just do an in-office visit. I sat down for about 45 minutes with their clinician who's in their office, just next room, easy peasy. They just send you right over. Sit down, told her exactly what I just told all of you guys about being confused, not wanting to wear the dress for my first communion, being uncomfortable during puberty, and then deciding that I'm a lesbian by the time I got to high school or during high school. And she said, yep, sounds like textbook gender dysphoria, which is just a fancy word. That's the diagnosis you get is gender dysphoria. It just means that you have extreme discomfort in your biological sex. So what it meant for me was I am so uncomfortable living my life as a young woman that it would be better for me to try to live as a man. And on the paperwork that they filled out, they have to write a letter. She put the only known intervention is a combination of, I forget how she worded it. She had a combination essentially of hormones and surgery. And that's how I got signed off to take testosterone and to have surgery. No therapist. Massachusetts law, I think, required that I had a therapist for at least 6 months, but because I had the referral for the clinic and then the in-office appointment, it counted. There was like a 6-month period in between. So it all counted and it worked out. And I was able to start testosterone in the spring of 2015 after one appointment at the gender clinic. And I only held it off so long, that 6 months, not because I knew anything about the restrictions, but because I just wanted to finish my finals or my midterms, whatever it was. It was my freshman year of college, and I didn't want to have to drive down to Boston in the middle of midterms week. Reasonable. So I went ahead and I started on the testosterone, and just like all the girls in the video said, I started noticing I have more muscle. My shoulders are more rounded. I have more energy. I'm just wanting to go, go, go all the time. If I want to fall asleep at night, I have to take melatonin because I just had so much energy that I didn't have before. Confidence too. So testosterone's a steroid. So all the things that I was experiencing are just effects of taking a steroid. So I'm taking this and I'm feeling stronger, more confident, less emotional. So it feels like my depression's cured, but quicker to feel angry at people. If somebody would misgender me, use the wrong pronouns, which means use the biologically correct pronouns, my mom or my sister, I would get mad and I would yell at them. And I remember a couple of times I did yell at my family members, something that I had not done in the past before I took testosterone. But I didn't really think anything of it because I wasn't really thinking at all, especially not about anybody else at the time. I totally focused on myself. What is going to make me happy is to transition to be a male because I don't want the depression. I don't want to have to live like this, and I don't want to have to do whatever comes with being a woman. The other thing that came with being on testosterone, that I have all this energy and I have more muscle, is people would comment. People close to me, they would comment and they would say, "You look a lot happier and a lot healthier than you've looked in a long time." All these factors combined, what was I supposed to think except this must be the right answer? People are commenting, "I look happy. I look healthy. I feel happier and healthier." So what conclusion was I supposed to draw except that the treatment's working? And it's working. It's working phenomenally because all these changes took place within a year. But by the end of the year, my voice was deeper, but it was leveling out. It wasn't cracking. It wasn't deepening much anymore. The muscle that I gained, well, if I wanted any more, I was going to have to start working for it. It wasn't just going to come naturally. And so I kind of reached a plateau with the testosterone. And I thought, well, maybe it's time to take the next step because when I started identifying as transgender, right, it went like this. Just putting on the new identity, no testosterone yet, euphoria. Huge wave of euphoria. That kind of plateaus, and then I come back down and I don't have that euphoria anymore. But then I start taking the testosterone, it shoots back up again. But then, it kind of starts coming back down. Things are just normal, settling into everyday life. There's no more changes happening. I need to chase that next high, that next wave of euphoria. So what was I going to do? I didn't want to wear the binder anymore. Now it's hot. It's the middle of summer. I don't want this on me. I don't want the compression tank underneath all my t-shirts. So what did I do? I told the gender clinic, I called him. I said, "Hey, I'm ready for top surgery." I said, "All right, no problem. We'll just sign off on it. No surgery no surgery necessary. Definitely a surgery necessary. No therapist necessary still. The office, because I'm a patient there and they have a clinician, they just sign off on it. Yep, this is how it's going. Things have been going well for the last year on testosterone. So we'll sign you up for top surgery." And top surgery is a double mastectomy to remove my breasts or anybody who has the surgery. That's what it is. And it's a lot like what breast cancer patients will get if they need their breasts removed, except that they try to construct your chest. They'll sculpt your muscles. They'll like kind of shave them down or do something so that you look more masculine, not just flat, but a little more masculine. And so I went ahead and I got that done when I was, let's see, I think I was either 20 years old or just about to turn 20. Um, I was just about to turn 21. I was 20 years old when I got that done. And of course, what happened after that? Wave of euphoria. I felt great. I didn't have to wear that hot, sweaty compression tank underneath me, underneath my shirts anymore. I wasn't sweating. I wasn't struggling to breathe because it's pulling on my ribs. And I could just walk around in my t-shirts and just have the flat chest. I just wake up in the morning, put my clothes on, and I'm good to go. That's all. And I loved it. that lasted me for about 4 years because I had no plans of doing any other surgery. Sometimes people will plan early on that they want bottom surgery and they want it by a certain time and they want to change their genitalia to look like the opposite sex. Um, I just hadn't gotten to that point, not for any reason. I just hadn't gotten there. There was nothing really stopping me from doing it. I just never got around to doing it, I guess, before I detransitioned. But what did happen, about 4 years later, I was 24 years old, maybe it started when I was 23 and just continued, I was having very severe abdominal pain. So like I said before, I had so much energy that I just loved playing sports. I'd go outside, I'd play street hockey, I'd play basketball, and I'd just be outside. I was still well, was I? So when I was in college, all summer I'd do that. And then when I started working, after work, it was perfect time to do that. I would just go outside, hang out with my friends all weekend. We'd be outside. Maybe we'd go out on my friend's boat or something. And I started having really bad abdominal pain to the point where if I was playing basketball, I would be doubled over in pain and just have to go home. It wasn't going to stop. And I couldn't bear it. And it got to the point where anything I was playing, I knew that if I ran too fast or tried too hard, I would end up doubled over in pain, barely able to walk myself home or drive myself home or whatever I was doing. So I went to the gender clinic and I said, "Hey, like what's going on? I think it might be my uterus." And the doctor there, he said, "It certainly is your uterus. What happens when you take testosterone, when a woman takes testosterone in a high amount like that, is what this is how he explained it to me. I don't know 100% the in and out, so if you have questions about it, I might not be able to answer. But he said your uterus sort of shrivels up and just yanks on all of your muscles that it's attached to, or tendons, or whatever in the world it's attached to. I have no clue. This happened, it was 2020 or 2019 when I said I'm having this issue. They said, all right, well, we're going to get you a hysterectomy early 2020 before COVID shut anything down. Early 2020, I scheduled a hysterectomy. Everything shut down, the whole world is closed, and they still did it, summer of 2020. Did a full hysterectomy. They removed my uterus, cervix, fallopian tubes, and both ovaries. Now, the reason I opted in for so much to be removed from me is the cancer risk when I'm taking testosterone. So they're like, well, now that you're feeling the effects of what the testosterone's doing to your reproductive system, basically just wreaking havoc inside of me, I'm at a really high risk for cancer, for cervical cancer and ovarian cancer, all those things that I wanted as a kid. But now I was like, wait a second, now I know what cancer is. I don't want that stuff anymore. And I'm like, yep, take it all. I don't need it anyway. That was my whole thing behind it. My whole justification was, well, I'm going to be a man. And what in the world does a man need ovaries for? I wasn't thinking he does. He just marries somebody with the ovaries. Like that wasn't happening in my brain. And I was like, I don't need any of that stuff. I'm not going to have kids because men don't have babies. And so just take it. And people ask me, do you want to freeze your eggs? They were asking me all these different questions. And nope, don't need it, don't want it. Just get rid of it. And I was actually really happy after the hysterectomy. Even though I didn't opt for it right away and it wasn't something that I thought would give me that wave of euphoria, it kind of did because testosterone. So I don't want to get like too gross or anything or too TMI, but what testosterone does is it will stop your period, your menstrual cycles to a certain point, but sometimes you'll have some remnants of that, right? And I was like, well, that's not something I ever want coming back. Or if I can't get my testosterone, if I don't take it in time, or it was weekly self-injections, so you'd have to put a needle in your own self and inject yourself. But if I went on vacation, I didn't always take it with me, and then I was worried, well, if I miss a dose, what's going to happen? Well, now I didn't have to worry about that. I was just, well, I know I don't have to worry about any of those annoying monthly cycles coming back to me. So I actually did get a little wave of euphoria. And I felt more like a man. Well, I felt more like a man, but I was not anything close to a man. I felt more like a man because now I'm like, well, now I don't have to worry about all these feminine things. I don't have to worry about the risk for cancer. I don't have to worry about any of this pain I'm in. I can just continue living my life the way I am. Keep taking the testosterone, keep living my life. And it worked out for me so well. Some people, they transition and you can tell they're trans and you're like, I don't even know what to call them. But most people in my life, I was 25 years old maybe, and they thought I was a 12-year-old boy. But still, they're thinking I was a boy, and that felt pretty good. And I was like, well, as long as they think I'm a boy, I don't care how young I look. I don't care if I'm too short or what it is. Can't grow facial hair, whatever the problem is that they don't think I'm a man. They at least think I'm male. Oh, well, I forgot to mention something. During the hysterectomy, I came out of the hysterectomy. This is actually a big thing I should not forget to mention. When I came out of the hysterectomy and I'm in the recovery room, my condition was getting worse and worse and worse. And for everyone who's ever had surgery or had a family member have surgery, when they're in recovery, they're a little like out of it, but they should be getting better and better fast. It's like, yeah, we got to get you out of here. This is a 1-day surgery. I wasn't planning on staying overnight, but I was getting worse, worse, and worse. They're like, something's not right here. We got to keep you overnight. They didn't know what it was. Just something was wrong. And I was in so much pain. I'm in too much pain, too much pain, too much pain. Couldn't move. Was waking up just like, oh, I don't know what's happening. I was getting really, really tired. They got me a hospital room, my own room, which was really nice. And when I had the hysterectomy, I was 24. So I was 2020. So I did get my own room, and I think it's because of COVID that they gave me my own room, but it was nice. But I was in the hospital bed, just writhing in pain, just going back and forth, and I had the IV in my arm, and I don't know what's wrong, and I told the doctors, "Please, can you give me something for the pain?" And they're telling me, "We already did." And I'm also confused because then they're giving me pain medicine. I don't even remember I'm having pain medicine. And then I started drifting in and out of consciousness. And I remember waking up a few times and then falling back into unconsciousness and waking up and kind of being like, oh, I kind of liked the being asleep part better because I'm not feeling all this pain. It was just like more peaceful. And the nurses, I remember they ordered an ultrasound. They're like, we got to do an ultrasound. Something's wrong. My blood pressure was decreasing, but my heart rate was through the roof. So they're like, so they did an abdominal ultrasound and they just found blood all pooling in my abdomen. I'd been bleeding internally from the surgery that entire time. Hours went by and I was just bleeding. Maybe I was too confused to know anything, but I think it was hours. And they said one of my arteries was open. I don't know if it was supposed to be open and then closed or was never supposed to be open in the first place. That I don't know. But they said one of my arteries is open and they need to do an emergency surgery. So as I'm, asleep and then awake and then asleep and then awake, they have me sign the paper. I actually remember signing the paper. They said, sign this. We're bringing you in for emergency surgery. I signed it. I woke up. I think I was even in the operating room. There's just a bright light. And I grabbed the doctor and I said, you have to put me to sleep, right? And he said, yeah, we will. We will. But then I fell asleep on my own after that. After that emergency surgery, I came out of there. They fixed the mistake. My artery was then closed up. The blood that was in me, they took, the blood that wasn't supposed to be pooling in my abdomen, they took out of me. I had to have 3 blood transfusions. That's how much blood I left. 3 blood transfusions before I could go home from the hospital. And somehow, even after losing all that blood, I made a full recovery. None of my organs had any damage. At least, I don't know that they have. There's nothing that's hit me since then that would cause me to believe that my organs are damaged in any way. But you would expect, I was already unconscious, my organs would have started shutting down, but they didn't. I'm very happy that they didn't. So I came out of that surgery and kind of decided, even if bottom surgery was going to be on my radar in the future, it can't be at this point. I was scared out of surgeries. And the other thing that was happening, I know I was 24 and I was an adult, but my parents knew everything that was going on. I was open with them. I have a great relationship with my parents still to this day. So they knew what was going on. My mom even drove me to Boston because it was a 1-day appointment. I wasn't supposed to stay overnight. Ended up staying a night or two. But she drove me to Boston so that she could drive me home safely after. Like, but my parents were awake, waiting by the phone to find out if I was dead or alive. They didn't know if their child was going to survive that whole process or not. And they weren't sure about the transition, but didn't have the framework to say, no, this is definitely bad. We shouldn't do it. So like, all right, well, we're going to be in Boston. These are the best doctors. So we'll do it this way. But I know, and I think they may have mentioned it sort of in passing, that if something would have happened to me, they would have blamed themselves. Whoever was more, supportive of it or less supportive, whether my dad or my mom, I don't know. They probably would have blamed each other. Like it would have just torn my entire family apart if anything else would have happened to me that day, if I would have died, basically. But luckily, They got the call. Oh, yeah, your kid's still alive. Good thing. But, even after that, I continued transitioning. I continued transitioning even into 2021, 2022. Even when I thought maybe I shouldn't, and maybe I won't take this as I did it again. And I just kept going back to it. I'm like, nope, this is right. And year after year, I just kept going back. I don't remember exactly like when it was that I didn't, but if I can get, but anyway, after that surgery, you would think, well, you just put your whole family through it. You had aunts and uncles not knowing what was going to happen. Your sister, I have a little sister. She's 2 years younger, so she was also an adult, but I'm supposed to be your big sister. This whole time I'm telling her I'm not. I'm your brother. And now she's like, well, are you going to live or die? My whole family is going through this. I'm putting them through this. And still, after the hysterectomy, I was too focused on myself to realize any of it. And I thought, well, I won't do any more surgeries, but that one wasn't so bad. It was traumatizing for all of them. It actually was so bad. That was terrible. But, transgenderism, as it does for everybody, and as it did for me too, it turned me completely into a narcissist. And now I'm only thinking about myself. I'm not thinking about anybody around me. I'm not thinking about my roles, my responsibilities, my vocations. My mom had 2 daughters. And then I tell my mom, you don't have 2 daughters anymore. You have a daughter. Yeah, sure. My sister is still your daughter, but I'm not. And I just took that from her. No, I'm not your daughter. I'm actually your son. As if I could grant that. I did the same thing to my sister. I told my little sister, all these years you grew up with a big sister to look up to. Yeah, forget it. That never happened. I'm your brother. I'm not your sister. You don't even have a sister. I did that to them. And my dad, like, what's he supposed to do? Now try to raise me the way he would raise a son? That doesn't work. So I'm just ignoring all of my responsibilities. If I'm to be a sister, I have to actually be a sister. I don't just get to change that. But what transgenderism does, what the entire gender ideology does, is it just focuses you on yourself only. And it's like, yeah, sure, you were given the role of sister, but it doesn't come with any responsibilities. We aren't defined by that. You were given the role of daughter, but there's no responsibilities attached. You don't have to do a single thing. But in reality, those roles are defined by their responsibilities to others. My relationship to the people around me and how I relate to them, that actually matters. And the sex binary actually does matter. But all that, they just threw it out the window for testosterone. Yeah, that too, but for transgenderism. When I finally did start to regret it, it was not that harsh wake-up moment in the hospital. What happened was I went for my normal haircut appointment, and I have a good relationship, or had a good relationship, but sometimes we still talk, with a barber shop in New Hampshire, close to where I worked. And I thought, well, I'll get a haircut, I'll go home, take a shower, because I had a men's haircut. I didn't want the itchy hairs on my neck. And then I'd go back into work because I was working the night shift. So I thought, easy peasy, I won't have the hairs itching me all night. Haircut, shower, back to work. And that's what I did. I got my haircut. Haircut looked great. She did the thing with the mirror, make sure the back looks good. Said, perfect. It's what I got every month that I went to get a haircut. And I never changed it. Creature of habit. I went home. I'm about to shower. I turn on the shower. I turn around. I'm looking in the bathroom mirror. I went, something's not right. And I just kept staring at myself in the mirror. And I'm thinking, no, I don't look right. Something's wrong. And I was thinking it's the haircut. And I'm looking, did she get it right? Haircut was fine. I was just finally, for the first time ever, I remember how old I was. It was after I was 24, 25, 26, something like that. I'll be 30 next month, for context, if anybody wanted to put that together. I'm looking in the mirror like, no, for the first time in my adult life, I was seeing myself as a woman. I'm looking in the mirror, and I'm thinking, why do I look like a woman? Why do I look like a girl? That's not right. That's not how I'm supposed to look. Nobody thinks I'm a woman. When I would tell my friends, hey, I just got to tell you something. We've been friends for quite a while. Just want to let you in on something. I'm actually transgender. I was born a woman. What my friends would say to me is that they would just kind of go, all right, where's the punchline? They thought I was making some sort of joke about being transgender, which is something that I would do. But I was actually being serious, trying to tell them, like, no, I'm biologically female. I'm actually a woman. I just look like a guy. But they didn't believe me. There are a few times they're like, yeah, okay, all right, Kaden, sure, I'll believe it when I see it. I'm like, I got the scars. And even still, I have scars on my chest. They're like, maybe it was heart surgery. Like, guys, just believe me. I'm not joking about this. So then they're, all right, fine, you're a woman. And they believe me, finally. But that's how much I looked like a man. When I looked in the mirror, I don't know why I saw myself as a woman, but I did. And I couldn't get it out of my head, but I had to be at work for 2:30, so I kind of shook it off, showered, washed my hair, got all the hairs off me. And when I got out of the shower, I looked in the mirror again. I'm like, oh, it's still not right. I still look like a girl. But there was nothing I could do at that point. I just had to go to work. So I went to work. I'm doing my thing, and at the end of the night, I looked in the mirror again in the bathroom at work after I closed up, and I just thought, yeah, I do still look like a woman. Something's not right here. And I just couldn't get that feeling out of my head. Every time I looked in the mirror after that, I just saw myself as a woman. And that first day that it happened, and I was looking at myself and I'm looking at my reflection, I just broke down in tears right before I went to work. Because one, I look like a woman. Finally, for the first time in my adult life, I'm seeing myself as a woman, something that had never happened before. And on top of it, I have a fresh men's haircut, and I just felt really stupid. I just felt like I messed everything up by doing this. And where am I going to go from here? It felt like there was nowhere to go. But I was still taking testosterone, so all right, crying time's over. You had your time, and now you're finished. 5 minutes is up. And I stopped crying. I went to work because I had way more control over my emotions when I was taking testosterone as opposed to any other time. But kind of put that in my pocket and ignore it for 8 hours while I'm working. But I just couldn't shake the feeling that I had really messed something up. I was listening to the Bible in a Year podcast by Father Mike Schmitz, which is a Catholic priest. He puts on a Bible in a year. He reads through it. He does some commentary. And at the time, I didn't have a church home. I'm Lutheran Church, Missouri Synod now. But I just thought, oh, Bible in a year. I should totally be listening to the Bible. That sounds like a good thing to do with my time. And as I'm listening, I thought, yeah, I did really mess something up. I couldn't have articulated it. I couldn't have told you exactly what it was, but I thought, I'm going to go to confession. And I went to a church in my neighborhood where I grew up. And I they have their confessional hours. It was a Catholic church. So they have their confessional hours, and you just go between this time, and you go to confession. And so I went, and I confessed my transgender identity to the priest. I received absolution, and really didn't know where to go from there. Tried to start wearing more unisex clothing. Well, it was men's clothing. I would not do anything without the label of men's clothing. But I would try to do just the men's t-shirts that don't have anything on them that, if you get them small enough, they could look like women's t-shirts, but, you never really know. I tried to do that to see maybe I'd be comfortable with that. And, but I didn't think that I should detransition because I thought, well, if I go admit this to anybody but that priest, all those people who, told, are you sure transition's right? My parents, my aunts, are you sure transition's right for you? Yes, I'm sure. Stop asking me if I'm sure. I've done all the research. I've watched all the YouTube videos. That was all my research, was YouTube videos, but nobody else needed to know that. I told them I did my research. Okay, I watched the transgender YouTubers endorse this stuff. So this is the right thing to do. And I thought, if I now go and admit to how wrong I was, nobody's ever going to trust me with a big decision ever again. I'm never going to be trusted if I want to be a teacher. As I hadn't written, now I work at a preschool. It's really nice, but I hadn't written off teaching. I had my bachelor's in history and I wanted to be a history teacher. I'm like, well, am I ever going to be trusted to do something like that if I can't even make a decision? Am I ever going to be trusted again? And I didn't think I would be. And the first time I expressed that, actually, the people in my life, they said, no, we trust you, because detransitioning was probably a better decision than transitioning in the first place. So they're like, yeah, we still trust you. But anyway, that's what I was thinking. And I was so deeply depressed. Every night I'm driving home from work, because I was on the night shift still. I loved the night shift. I loved closing the gym. I worked at a gym. Loved closing because for those last like 20 minutes, it was nice and quiet. And you had never seen a gym so quiet. There's no music playing, there's no weights slamming. And I love being in the gym and kind of having that atmosphere. And I loved where I worked. But I loved the closing shift because it's like all that and then peace. All of a sudden, you'll lock everyone out, turn off the music. It's like, oh, I can just clean up in silence. So I worked the night shift, and every night I'd be driving home around 10:30 at night, and I'll just be thinking, I don't want to be alive anymore. Maybe I should just drive my car this way or accidentally swerve into the next lane. And, it looks like it's an accident, and my parents won't think that I wanted to kill myself. And so at least they wouldn't have to live with that because I'd lost a friend to suicide. My friend group had lost someone close to us to suicide. And we always ask ourselves, and probably people in this room, you've lost people and you ask yourself, why didn't they just call me? I would have gone over. But then I understood why he never called any one of us. Because you just feel like you're a burden to everyone, like you're a burden to society. You're just ashamed of it all. And you just want it to be over. Like, what's a phone call going to do? Maybe I won't be depressed for 10 minutes and then I'll just start being depressed all over again. So every night, that's how I was feeling. But I was still listening to the Bible podcast. I'm still listening to the Bible, and everything's going really well with that and learning a little bit because I had not read the Bible before. It's in my mid-20s probably, and I'd never read the Bible. And I forget when it was, if it was at the end of the year, must have been. I wanted to go back to church. And I thought, well, now I just need to find a church. And there was a Lutheran church, Missouri Synod, next to my work. I thought, well, that sounds like a good one, but I better look them up because I had, what did I have for criteria for church? I may have had 2 or 3. I wanted the sacraments. And if anybody told me your baptism isn't valid because it happened when you were a baby, I just walked out the doors. Listen, that was the only thing that was keeping me going. When I felt like I was falling, when I was so depressed that I was wanting to die, I felt like I was falling off a cliff. And the way that I've pictured it, I hope it's a good enough illustration for everyone here. The way that it felt was like a cartoon character looks down and then just starts falling. Can't stop themselves from falling, reaching out for anything. No matter what I reached out for, nothing would hold me. But then the one branch that I grabbed onto was like, oh, wait a second. I'm a baptized child of God. It was like there was a branch right there. Now I'm being held. Okay. This is what I can center everything on. And I can go up from here. Like, this is all I need. And so if I would have walked into a church and they would have said, no, we got to rebaptize you, then I would have said, no, you don't. I know for a fact that my baptism is valid. I didn't have all the vocabulary yet to say it. But when I went to talk to the pastor, who was a great pastor, and I told him, I'm okay being Lutheran, but I'm not getting rebaptized. And he said, I would never do there's no such thing as a rebaptism. Like, all right. Probably not exactly how it went. He says what I did was I went into his office and we talked for about an hour and a half. And then he said, is there anything else you want to talk about? And I said, oh, yeah, there is one more thing. I'm a woman. I was born female and I'm transgender. And that was like the moment that he's like, let's make another appointment. We got to come back to this. This is a big one. But anyway, my other criteria for a church was I wanted the church to be so conservative that no matter what I said, I could be kicking and screaming. Not a single person was going to affirm me as a man. Because that's what I wanted. It was like, I want for every person to just think I'm a man and just tell me that that's okay. But I knew at this point, I don't know why I knew, probably because I was more immersed in the Word of God, but I knew that I was not a man and that I was to live in truth. But I kind of had to force myself because I wanted nothing to do with truth. It's like I wanted to be so far away from it. I wanted to go to the ELCA church that was just going to tell me what I wanted to hear. But nope. I went to Grace Lutheran Church, and that's where I went, and that's what I stuck with. And the pastor introduced me to a few members of the he introduced me to everybody. So yeah, sacramental and super conservative that they're not going to call me a man. They're only going to call me a woman. So my pastor said, I think it'd be a good idea for you to just go by Katie. No more Kaden. So, all right, can I do that just at church? So yeah, you could be anyone here as long as, within reason. Couldn't be Kaden there. But he said, yeah. just at church. You don't have to tell your family. You don't have to tell your friends. You can just be Katie for an hour every Sunday. And that was good enough for him. And so I said, all right, I'll try it. I'll try it. And he introduced me to a few ladies in the congregation. And they started calling me Katie. And it was like fingernails on a chalkboard. Hated every second of it. Did not want to be called Katie. Wanted to be called Caden. Every Sunday, I'd get to the church, park as far as I could off in the corner, and walk in, clenching my teeth, right? Just like the minute I open this door, what am I going to hear? Hi, Katie. Hi, Katie. Hey, Katie. How's it going, Katie? I didn't want to hear that. It's like first thing in the morning. I just rolled out of bed, and everyone's going to call me the name I don't want them to call me. And sure enough, I opened the door of the church. That's exactly what happened Sunday after Sunday, and eventually it wasn't so bad. And I thought, well, maybe if I could do the name thing, maybe I could also do the clothing thing. Because I know my feelings are wrong, but it took everything in me, and I thought I'm going to throw away all my socks. Not because I wanted to go barefoot. I hate being barefoot. But because they were all men's socks. And socks don't really matter. But to me, they did, because of how difficult it was to get myself to even be okay wearing clothing with the label of woman. So I threw away all the men's socks. I went on Amazon because I was not going to walk through a women's section at the store. That would have set me off. But I went to Amazon and I ordered women's socks. And you know what I ordered? I ordered the ones that look like men's socks. But every single morning, it was like mental anguish getting myself dressed. I would not want to do it. I don't want to wear the socks. I don't want to wear socks that are not men's socks. But I needed to wear socks, otherwise my shoes would smell really bad. So every morning, I put my socks on. And they didn't look any different. No one would have ever known. That probably still people wouldn't know if my socks are men or women's. And half the time, I don't even know anymore. But at the time, I couldn't do it. I couldn't get myself over that. But every day, I'm putting them on. And I'm like, I know that Satan's a lie, okay? I know that I can wear these socks. But I wasn't strong enough to do it. But God was strong. God is strong enough to do it. And that's who I was relying on. And so every morning I did it. And eventually, I didn't even think, I actually kind of grew to like the socks. I was like, well, when I wear holes in these ones, I'm going to get another pair of the same ones. Loved them. So then I was okay with wearing the women's socks. And then the shorts. And then the shirts. And then skirts and dresses. Grew my hair out. And over time, it just didn't hurt as much. I just basically had to desensitize myself to it and tell myself, get with the program because you have to be normal. You don't have a choice anymore. But the whole time, obviously, my focus was on Christ and was on my baptismal identity, not just in I have to do this, I have to do this, I have to do this. Because if it was anything that I had to do for myself, it wasn't going to get done. I wasn't going to do a single thing if I was relying on my own strength to do it. But eventually, I would say now, like, I don't even think about transitioning or detransitioning day to day. There's no more, I want my hair to be longer. I kind of like the length of my hair. I like to have it in a ponytail. My husband tells me it's practically feminine. I think that's what he says. But anyway, I've been speaking out on the topic for quite a while, as I mentioned before. I did get married in October of last year. Probably just skirted right by that. Thank you. Yep. Thank you, guys. Yep, to my husband. He's here today, too. And that's another role that I put on. Now I'm a wife, and I don't get to just, oh, well, no, I don't feel like being a wife anymore. That's not how it works. I'm Josiah's wife, and whatever comes with that, whatever is my responsibility, that's what it is. And I can't just change those roles and all of a sudden become a husband, because you certainly wouldn't like that. No, he would not. But I think that might be enough about me. I'd like to open it up for questions if we have enough time for questions. Hopefully, maybe a few.
Thank you, Katie. I am humbled by your story. It's amazing. For all of us that may be dealing with this issue now or in the future, is there anything that somebody could have said to you in this kind of 12 to 16-year-old range that would have helped you or would have mattered?
So there are some things that I wonder if they would have helped, because I can't say for sure. And those are, well, at a young age is probably just being raised in what's normal. So that doesn't always work, because then your kids grow up and then the issues of the day, they change. Yeah, I was raised so long ago that if now transgenderism is becoming popular, did I have the framework back then? No. My parents never talked to me about transgenderism or LGBT. They didn't think they had to. But a couple of the things that I do wonder about is questions like, to pull me out of sort of the ideological thinking, would be, what do you despise about womanhood? What is it that you don't like? Or what is it that you covet about manhood? Things like that. Now, on transgenderism specifically, to pull somebody out of an ideology, I have come up with a list of questions. I'll share them. But I would just say, if you're going to use any of these questions on, loved ones who you care about deeply and want them to stop going down whatever path they're going down, don't expect that your family member will actually answer the question. What it is just to get them thinking. And a question would be, what does the end of transition look like? Because for a lot of people, if they're going to think about that, that thought's going to ruminate in their head. What is the end of it? We don't think about the end of transition. You have this idealized image of what a man or a woman looks like, and that's what you're trying to get to. But you don't really think about what's the end of this or what's your motivation behind it. So it's sort of open-ended questions like that. What do you despise about why I already said that one? Let me think. What are some other ones? Josiah, do you remember any other ones on my list that I forget?
And you hit the two big ones there.
Yeah.
Yes, it's just open-ended stuff.
Yeah, I think just open-ended questions and just being able to be honest and to show the realities of it. I think a lot of people have wanted their loved ones to listen to a detransition. Oh, this is something important. Detransitioners talking. When I get up here and talk, if a trans-identified person or even activist comes to listen or turns on the YouTube video to listen to me or whatever, that takes an incredible amount of courage. I saw the videos before and during my transition of, this is why I detransitioned and why you might too. And I said, nope, that's not me. I'm never going to detransition, and I know I'm never going to detransition. And if I watch that video, it's really going to get me thinking, and I was afraid of thinking. And I couldn't articulate that at the time. It was just like, no, don't show me any of that. That is so bad. You shouldn't hold people back from transitioning. But I do want to say that when you're having conversations like this, especially with someone who's already fallen into it, like if we had a trans person sitting right here, I would commend them for their courage, because I would have never done it. It's actually scary to have somebody attack your identity and you just kind of sit and take it and not be able to respond to it. I've also had protesters who have tried to respond to me, but they don't ever do a good job. But anyway, it's really important to be gentle, kind of a neutral tone, but also loving. But it's almost like parents tell me, if they show too much emotion when they're talking about it, their kids kind of get scared away. You're either too happy or too angry about something. It could scare them away. And I mean, it makes sense, because you think about it, when you're a child developing, you look at your parents' facial expressions to determine, what they're thinking, what they're feeling, and you kind of go off that. So I don't know if there's any one question or one conversation that would have turned me around or would have helped me to understand the world around me. Probably being more of a church family could have done it. But if somebody's to approach those sensitive topics, especially with people who are already going down that rabbit hole of LGBT nonsense, I guess, that I would just be gentle and loving and ask open-ended questions, hold your ground, don't use the pronouns, and don't use the name. Yeah, I would just steer clear of all that. And if they don't answer you, if they say, I don't know why, I don't know what the end of it looks like, just stop asking me, that's gonna sit in their head, because those types of questions have to pull them out of an ideology in order to even think about it. Not even just to answer the question, but to think about it. You kind of have to be pulled out. So those open-ended questions, I wouldn't expect an answer. I would expect a quick, smart answer. And then hopefully they just kind of ruminate on that and come to their senses. But for me, it took years and years, botched surgery, and a year of listening to the Bible before I even thought, I might have made a mistake somewhere along the lines. So it's probably not quite as simple as we want it to be.
I'm curious about your experience in confession the first time around with the Catholic priests. You mentioned you didn't know where to go. Why is that?
So, like, I didn't know where to turn when I started to regret my transition. I couldn't go back to any gender clinic. I did go back, but I couldn't go back to the transgender groups or anything like that. These people had helped me to transition, and it didn't seem like they would help me do anything. But now I know I totally could have gone to my parents and to my family, but I was afraid of what their response would be and if they'd ever trust me again. So I went to the one place that I knew could not turn me around, and that was church. And the church that I was raised in is the Catholic Church, and I had gone to St. Joseph's in my hometown. That's the Catholic church that I went to. I'd gone there all the time to light candles and stuff as a kid. My grandparents would take me. And so I looked up, there were a few churches right around me in the same neighborhood. I kind of looked up the confessional hours, all Catholic places, and went with the one that worked with my schedule, and that was St. Joseph's, which was a place I was familiar with. But really the thought was, kind of thought, well, what if I told this person and this person and this person and this person and this person? There was so much fear about, well, what would their response be? Would they trust me? Would they help me? Would they be able to? But I knew that if I went to church, well, what was the priest going to do? No, get out of here. You're too bad for us. Like, you're the worst sinner and you can't. It's like, yeah, I am, but so are you. So that's how I landed on church. And I think I also decided on going back to church and going to confession while I was listening to that Bible podcast. So I think that has a lot to do with it, where it's like, okay, yes, this is something that I'm thinking about and something that is active inside of me and all that. So that's when I decided church. But it really was when you have nowhere else to go. Well, who can't turn you away? And it's Jesus. And so that's where I went. I was like, I know where to find him. Thank you so much.